Hello, and welcome to part one of our Medicare 101 educational video series, The Basics of Medicare. It's time to explore the foundational elements of the Medicare system. Today's objective is to provide you with a clear, factual understanding of exactly how Medicare works in 2026. While Medicare as a whole stays mostly consistent, parts and pieces of Medicare change every single year, so it's important to stay up to date. Let's go through this straightforward overview so you can navigate your healthcare options with complete confidence. Now, as an independent brokerage, Medicare Made Simple serves as your trusted advisor. We don't work for the government or the insurance companies. Rather, we work directly for you. Our role is to give you a grounded, fact-based overview of your options. We're here to strip away the confusion and, as our name says, make Medicare simple. We will present the facts and details you need so together we can help you make an informed decision about which Medicare plan is right for you. Let's get started. First, we'll look at the 4 parts of Medicare. Second, we'll cover navigating the windows and penalties you could face while enrolling into Medicare. And third, we'll discuss the importance of working with an independent brokerage partner. Let's start right in with Section 1, the 4 parts of Medicare, or as I like to call them, the ABCs and D of Medicare. Understanding these distinct components is really the mandatory first step in structuring your coverage. Original Medicare consists of 2 main parts. The first is Part A, which functions as your hospital insurance. Part A specifically helps cover inpatient care within hospitals, skilled nursing facility care, hospice care, and eligible home health care services. To make it really simple, you can almost think about Part A as the confinement part of Medicare. You use Part A when you are confined or spending the night somewhere. Now, if you or your spouse have worked and paid Medicare taxes for at least 10 years or 40 quarters, you typically do not pay a monthly premium for Part A. The second component of Original Medicare is Part B, which serves as your medical insurance. Part B helps cover the day-to-day medical services you need. This includes items such as visits to doctors and other healthcare providers, outpatient care, durable medical equipment like wheelchairs or hospital beds, and many preventative services such as screenings and your yearly wellness visits. Medicare Part B has an annual deductible that is currently $283 and then typically becomes an 80-20 plan. When something is referred to as 80-20, this means Medicare is going to pay 80% of the bill and then you are left with the additional 20%. Unlike Medicare Part A, that is at no cost to most people, Medicare Part B typically has a monthly cost. The current standard premium for Part B coverage in 2026 is $202.90 per month. Most individuals enrolled in Medicare will pay this amount directly to the government every single month, and it's typically just deducted right from your Social Security benefits if you are already collecting. If you are not collecting Social Security yet, Medicare will bill you. This is simply a standard cost you need to factor into your retirement budget. Now that we've briefly talked about the 2 parts of Original Medicare, we get to where your coverage can veer off down different paths. The first path is Medicare Part C, which is traditionally referred to as Medicare Advantage. The second path is Original Medicare Part A and B paired with a Medigap plan, or Medicare Supplement plan. Taking the first path, Medicare Advantage plans are health plans offered by private insurance companies that are approved by and contracted with Medicare. Essentially, a Medicare Advantage plan bundles together and provides all of your Part A and Part B benefits, and they frequently include additional benefits as well. Some of these benefits can be items such as dental, vision, or hearing benefits. Some plans will even have items like over-the-counter allowances, transportation to doctor's appointments, or with a few select plans, even grocery or food benefits. It is also important to be aware that plans that give you a large amount of these extras do not pull money out of thin air, regardless of what some advertisements may lead you to believe. They typically need to lower or weaken benefits in other areas in order to afford the additional supplemental benefits. Along with the inclusion of the extras, Medicare Advantage plans will typically replace the 80-20 model of Original Medicare and replace it with set copays. A copay is a fixed dollar amount that you pay for a service. For example, a plan may have a copay of, let's say, $35 if you go see a specialist, or it may have a $300 copay if you have an outpatient surgery. These benefits all vary by plan, and if you elect to go the Medicare Advantage route, figuring out what benefits are right for you is part of the process of figuring out which specific plan is the best fit for you. The final core component of Medicare is Part D, or your prescription drug coverage. Since original Medicare doesn't generally cover everyday prescription medications, Part D is a necessary addition for most people. Similar to Part C, Part D plans are run by private insurance companies, and they must follow specific rules set by Medicare. A crucial point here is understanding your financial exposure when it comes to medications. There is a very significant update for the 2026 plan year. Your yearly out-of-pocket costs for covered Part D prescription drugs are now capped at $2,100. Once you hit this spending cap, you won't have to pay a copayment or coinsurance for covered Part D drugs for the rest of that calendar year. On top of that, as of last year, in 2025, the dreaded donut hole no longer exists. This helps with limiting the surprise costs later in the year. When it comes time to make your choice, we can help you compare original Medicare against Medicare Advantage. With original Medicare, you get the flexibility to use any doctor or hospital anywhere in the US that accepts Medicare. However, you will also need additional plans to fill in the gaps that Medicare leaves behind. As I mentioned before, these plans are called Medicare Supplement plans, which are commonly referred to as Medigap plans. These plans are purchased at an additional cost above and beyond what you pay for your Medicare. We will discuss more about Medigap plans in a future video. If you select a Medicare Advantage plan, you typically must use doctors and healthcare providers that are established within that plan's specific network. Some plans have vast networks covering a large number of providers, and some plans have smaller, more specialized networks. With many of these Medicare Advantage plans, you will not pay an additional monthly premium and have a plan design where you have fixed costs as you use the plan. Both paths are viable and the correct option for different people, but they clearly operate under different rules. Moving on to Section 2, Navigating Windows and Penalties. Medicare is administered through a strict set of government timelines, and failing to adhere to them can actually result in permanent financial penalties. Your primary opportunity to secure coverage is called your initial enrollment period. This is a precise 7-month window. It begins exactly 3 months before the month you turn 65. It includes your birth month, and it concludes 3 months after the month you turn 65. If you enroll during the first 3 months of this window, you ensure your coverage begins promptly on the first day of your birthday month. Fun fact that we rarely hear people reminded of: if your birthday happens to fall on the first of the month, your birth month by Medicare standards is the month prior. So, if your birthday is, let's say, June 1st, your Medicare will actually go into effect May 1st, and this timeline will be adjusted accordingly. Little nuanced details like this one show. While it is important to educate yourself, it is also crucial to speak with a licensed independent insurance broker to help you through the process. Now, if you are working past age 65 and you currently have creditable employer coverage, you may qualify for a special enrollment period. This gives you an 8-month window to sign up for Medicare that begins the month after your employment or group coverage ends. If you happen to miss both your initial and special enrollment periods, you're restricted to the general enrollment period, which runs from January 1st to March 31st each year. But be aware, individuals utilizing this general enrollment period often incur penalties. Missing those mandated enrollment windows triggers distinct financial penalties across the different parts of Medicare. If you must buy Part A and you enroll late, your monthly premium may increase by 10% for twice the number of years you delayed. For Part B, late enrollment will also cause you to incur a penalty of 10% per year you delayed enrollment without having other credible medical coverage. High-income earners may also incur what's referred to as an IRMA surcharge, or a higher monthly cost due to their higher income. For Part D, delaying enrollment results in a permanent monthly premium increase, which is calculated directly by the amount of time you spent without coverage. Let's discuss IRMA for a moment, which stands for the Income-Related Monthly Adjustment Amount. Medicare assesses a larger Medicare premium to higher income earners through this provision. Using your IRS tax return from 2 years ago, if your 2024 modified adjusted gross income was above $109,000 for an individual or $218,000 for a joint filing, you will be required to pay an extra charge on top of your standard Part B premium. Medicare's regulations on IRMA can be complex, but something we are well versed on. If you have an IRMA charge or are going on to Medicare and think you might be subject to one, talk to one of our brokers. We are happy to help you figure out the true details of your situation. Moving on from IRMA, let's show you how the late enrollment penalties compound by reviewing the math behind the Part D late enrollment penalty, as these costs are permanently added to your premium for life if you become subject to them. If, for example, you went 29 months without coverage, you face a 29% penalty. Medicare multiplies this by the national base beneficiary premium, which is currently $38.99. In this scenario, that equals an additional $11.30. That 29% penalty will be added to your premium every single month for as long as you have Medicare drug coverage for the rest of your life. To avoid that Part D penalty while working past 65, you must maintain what is officially defined as creditable coverage. This means your current employer's prescription drug coverage is expected to pay on average at least as much as Medicare standard coverage. If there is ever a period of 63 or more days in a row where you lack either Medicare Part D or other creditable coverage, that late enrollment penalty will officially apply. A very important item that many people miss and don't find out until it is too late is that Medicare does not consider COBRA as credible coverage. So, if you retire when you're eligible for Medicare but decide to stay on your employer plan using COBRA, you're going to face a major issue. Putting off your enrollment means you will be subject to the late penalties we just talked about. Unfortunately, anti-age discrimination laws prevent your employer from attempting to talk you out of taking COBRA. So many people don't figure out it was a mistake until it's too late. This brings us to Section 3, working with an independent broker partner. Given the strict enrollment periods and the severity of the financial penalties we've just reviewed, attempting to navigate Medicare alone really isn't recommended. Partnering with an agent or broker provides you with some distinct advantages. First, we serve as your independent advocates. We aren't bound to any single insurance carrier. Second, we utilize specialized software and tools to meticulously verify that your specific doctors are in-network and that your prescribed drugs are covered at the lowest possible cost. We also learn and study all of the plans offered in the areas we service, so we can provide solid guidance when selecting plan options. And finally, we provide consistent year-round support to assist you with any questions you have about your plan or issues you are having not only now, but in the future. As I mentioned before, we are your advocates. We are not just here to enroll you in a plan and then disappear. Most of the clients we help, we build long-standing relationships with, and they stay with us as their trusted advisor for years upon years. Our independence is key. We work directly for you, not the insurance companies. This matters as plans can change annually, and you need someone who will be here for years to come to help make sure you are in the right plan, not only this year, but each year going forward in the future. You are making decisions right now that will dictate your healthcare access and your financial liabilities for the rest of your retirement. Relying on our professional expertise completely removes the burden of managing these complex Medicare regulations yourself. We handle the technical details, the carrier comparisons, and the enrollment paperwork, ensuring that everything is executed accurately and on time according to federal guidelines. That concludes our 101 review of the basics of Medicare. Understanding Parts A, B, C, and D alongside your specific enrollment timelines is essential. But the question remains, are you certain you have the right strategy in place to shield yourself from lifetime penalties and secure your healthcare access? We invite you to contact Medicare Made Simple or one of our independent brokers to schedule your individualized fact-based consultation today. Let us put our specialized tools and independent advocacy to work for you, ensuring your retirement is properly protected. Thanks for watching. If you found this information helpful, please share it with anyone navigating Medicare. We look forward to working with you, and we'll see you in part 2 of our series.